give the call to the Leader of the Nationals.
Thank you, Mr Speaker. My question is to the Minister for Health and Aged Care. How many rural towns have now lost a local GP following the government's changes to distribution priority areas?
I give the call to the order. Give the call to the Minister for Health and Aged Care.
Well, Mr Speaker, I'm very pleased to have another opportunity to talk about what this government is doing to address the crisis in general practice. This morning, a number of members across the parliament met with the College of General Practice, some of whom join us here in the chamber today, to address what I think is the worst crisis in general practice in the almost 40-year history of Medicare. And it's not just a crisis in rural and regional Australia, although the crisis there is certainly more extreme than in the cities. It is a crisis in the cities as well. And for members of the former government, albeit not with the Leader of the Opposition here, given what he did to the Medicare system in his short time as a health minister, but for members of the former government to get up here and in a holier-than-thou way seek to lecture others about what is happening in general practice stretches irony to its limit. I'll tell you what happened, Mr. Speaker, in the area of
the member for Page. I can hear very well. Can I give the call to the Leader of the Nationals on a point of order?
Relevance, Mr Speaker. It was a very tight question about the number of rural towns that have lost a GP because of the change in policy around the distribution priorities. Very specific. Very specific.
I'm listening carefully to the minister. He is answering the question, and he is 1 minute into his answer. So he has 3 minutes to answer the question. So I give the call to the Minister for Health and Aged.
I'll tell you what the College of General Practice and other groups in the health sector tell all of us, including over on that side of the parliament I know, and that is that 6 years of a freeze to the Medicare rebate, ripping away the ability to recruit overseas trained doctors from 140 different general practice regions in 2018, which is what this question is about, has created a crisis in access to general practice, not just in rural towns, but in metropolitan communities across Australia. He knows that. The Deputy Leader, the Leader of the National Party knows quite clearly that the crisis in general practice that they created has made it harder for Australian patients across the country to see a doctor than it ever has been. Not only harder, more expensive than it ever has been. And I tell you what, it sits very, very badly in the mouth of those opposite to get up here and seek to lecture us about a crisis that was of their creation. I tell you, Mr Speaker, there is no higher priority for this government than to rebuild general practice after the vandalism of the last 10 years. We put strengthening Medicare right at the centre of our election platform. We are sitting down with them every month, the College of Rural Medicine among them, the Rural Health Commissioner among them, to talk about ways in which we can improve access to general practice across the community, in the cities, in rural towns, in remote communities. We also, at the October budget, put in place a rural general practice package to make sure that there are innovative models of care being trialled across rural general practice, that there are more training placements under the John Flynn program. We have a priority on rebuilding general practice. All the others have is cheap politics.